37 million people here in the United States have chronic kidney disease. That's more patients with chronic kidney disease than type 2 diabetics and patients with reduced ejection heart failure combined. And that's not even the worst of it. Hey everyone, it's Dr. Dan, and today we're going to be talking about a very personal matter, chronic kidney disease, a disease that has affected your and even my family in one way or another. The sad reality is, of those 37 million people that we just talked about, only 10% of those people are properly diagnosed. Let that sink in for a second. That means 1 of every 10 people get the appropriate diagnosis, a diagnosis needed to save their life. And honestly, it gets worse than that. Of those 10%, only 10% of those patients get adequate therapy. Let that sink in for a moment. That means of the 37 million people with chronic kidney disease, only 10% of patients get diagnosed, and 10%, or 1 of every 10 of those, get the right therapy. The right therapy for a chronic, progressive, and deadly disease. A deadly disease that shows no signs until it's too late. There's an absolute reason that the CDC labels it as a leading cause of death here in the United States. The statistics speak for themselves. Just from what I just said, you can feel the gravity of the situation. It's something that we all need to be very vocal and aware about. And quite frankly, having 1 month be Kidney Month and a few social media posts every now and then is just not enough. Despite how dire the situation really is, there is a simple solution. We need to start a movement. And that movement needs to start not today, not tomorrow. It needed to have started yesterday. This is only my second video here on YouTube on this channel, and I don't think I have any right for me to ask you to do this. But I strongly feel passionate about what we need to do and what I'm gonna ask of you. And the ask is very simple. Grab your phone, grab your tablet, use your computer, whatever you're watching this video on, and share this video and tell your loved one who either has diabetes or your loved one that has hypertension, and tell them to skip to this part of the video because this is something they need to hear. I want to share a story, something personal, to make all of us connect and understand how dire the situation is. The story surrounds my grandfather, one of the toughest people I have ever known or have ever met. The reason I say he's so tough is because he grew up in a communist country that was plagued by World War II, just barely escaped the Jewish genocide. And for me to say he lost everything would be an understatement because it happened multiple times till he finally came here to the United States. So when I say he's a tough cookie, I really think he earned that title. The purpose of the story is to not show off how fancy my grandpa is, how brave he is, how this or that because he went through all those terrors. The point of the story is that for such a guy who went through all of those things, for such a guy who can talk about those topics so easily, there was one topic that would literally change him in a moment's notice. Literally cause his skin to be clammy, his skin to crawl. And that was always the topics of dialysis. The reason you're watching this video and the reason this video may have been sent to you is not to scare you, but to bring awareness to the topic of chronic kidney disease and what you could do to preserve and protect those kidneys, the organs that is so overlooked. What you need to do right now, and when I say right now, pause this video the second I'm done with this sentence, and then come back once you do this. Make an appointment with your doctor. Demand to make sure your EGFR and your UACR are screened. In a perfect world, 3 or 4 times a year is optimal, but once or twice is better than 0. Now, why would I want to screen my EGFR? That right there shows us how well the kidneys are filtering the blood. What about UACR? Another fancy medical acronym. What that allows us to do is to really see if there's any structural damage to our filtering organs. One fatal flaw that my grandpa did was wait. Chronic kidney disease is not apparent. It doesn't just show up and you know you have it. Unfortunately, when the signs start coming out, it's already too late. And the reason I want to bring more awareness to you is because we need to know how many people are affected by this. We need to change the fact that only 1 of 10 people are diagnosed properly. Because think about this. 1 of 3 diabetics have chronic kidney disease. What about patients with hypertension? 1 of every 5. Help keep yourself out of that dialysis chair. And the only way to do that, the only way to keep you out of that chair, from having any cardiovascular problems, to keep you from losing time with the ones you cherish, is to join this movement and get screened. If you made it this far through the video, I truly hope there was something to take away from it. If you want to learn more about chronic kidney disease or the treatments that surround it, or even just other videos on simplifying the complex world of medicine, please consider subscribing to this channel, liking the video, and give me one of your ideas or questions down in the comments below. We really can make a difference, and with this video, the movement has begun.